I think first, before it goes to the audience, one, I would like maybe each one of you to comment on what you've heard till now. Do you see any common patterns or something which should have been different or similar? And then we might go on to the sectoral thing. So, can we start with Professor Matthew Burton? So we've heard talks from both the individuals and the institutions, and they're all service delivery institutions. So anything that, yeah.
Excellent. Power. Hi, a really interesting series of talks. Lovely to hear about the different experiences. I think one thing that I think Simon, I think it was you who touched on this, was the importance of ecosystems, both locally and then kind of a wider ecosystem, and particularly the local team and the environment. It's much more than just having somebody who's got a PhD in there. It needs to be an environment in which research is kind of valued, it's wanted, and can flourish. And that requires multiple different skill sets, both technical, academic, as well as administrative and other. So that was I think a really important point and one to perhaps think on more.
Mr. Thulsiraj.
To me, the common theme that came up was need for mentoring and hand-holding. I think, and I can speak for India, probably Nepal as well. I think research per se was not part of the ecosystem, even in the academic setting. All doctors, when they do their masters, are required to give a thesis. And then if you look at the thesis, you will know that it is not research. It is 100% of the time it's a case series. So which really means the faculty itself is not equipped to guide the students. So the ecosystem doesn't exist, and that's what we are having as the raw material. So I think that this whole area of the helping individuals, helping institutions is very critical. And another thing which came up is at institution level, when you have multiple ophthalmologists working, I think there is a case for developing a research support system. I mean, just like we have for any other functions, we have a unit, for registration for this. I think we need to think in the same way for supporting research, and it's good that Tilganga does have such a unit. But I think you need to come to a certain scale and tipping point before you can afford one and have them meaningfully engaged. But that is something to institutionalize the capacity. Otherwise, the research capacity kind of goes away with the individual once they leave. So those are some of the common thoughts.
Thank you. Yep.
Thank you. I heard time and time again, serendipity and chance. Priya just happened to be in the group photo next to Nathan Congdon. They started talking about something. She was another place near Ken. All these things were just, and that's because she had research on her mind. She'd been looking at what she'd be interested in. She'd been looking at the question, how am I ever going to move beyond solely my big passion of management to be able to also add a research element. So because this was in her mind, and I guess she put out the vibe, I don't know. I'm from California, that's how we work. But I think she was able to, kind of get the conversation going in ways that was comfortable and very productive. So I think just having an interest, cultivating that interest, and maybe another thing we can talk about is how people go about developing that interest when they may feel like they're the only person in their institution who wants to do research, and they may not feel it's their place. And there are a lot of things that keep people back. But I think being open and being open to opportunity in everything we do is very important.
Thank you. Yeah, Professor Ken Bassett.
Thanks. Thanks all. I was thinking as I was listening to the speakers speak, especially the ones early on in their careers, I was thinking about the international academic challenges and international academia, and what happens when you're working in a North American or European setting is that you're rewarded for teaching. You have to teach. You have to have graduate students. You have to publish, and you have to get grants. But if you have graduate students in your own country, you get credit. If you have them elsewhere, you don't. So one of the things that we need to work on in the West is we don't promote our academic faculty for this kind of research capacity building in other countries. So I know there's a lot of very successful institutions here, but there's also, this week, we met a number of places that are just starting out. So if I can identify someone like Priya or Manisha or others who are interested, and I'm exporting my academic graduate program offshore. So now the university doesn't know what to do with that. And similarly, if I have a grant if I help somewhere here to get a grant, and the grant goes to build a research infrastructure here, there's nothing for the university at home. So when they look at promoting someone and all the money's going somewhere else, there's nothing for the institution. We have real challenges still in getting and promoting and supporting this type of work, even though it's so valuable, and it's probably the most rewarding thing you can do as an academic, is to kind of grow up with the people and watch them learn and see the impact of them gaining knowledge. But so on our side, we have a lot of work to do. But thank you.
Thank you. I think you already maybe answered the other next question I was coming to, what we can do different or better at sectoral level. So maybe I'll take that question now to Dr. Susan. Do you think anything different has to be done, what is being done at individual or what is required at an institution level? But when we think of a sector, something different needs to be done.
Well, I think this is now really coming to the fore as a question, because finally the broader global health community and the UN, other institutions are finally interested in us, recognize the need, want to know more about what we're doing, and they want a lot of data. Well, for us to keep up with that interest, we need to have very, very good programs for generating data, using those data, and improving programs based on the data. And so I think we're at a whole new level now, where finally data gets more appreciation, more recognition, but we still have a lot of work to do to develop the systems at the individual and institutional and regional level to generate those data and use them. But it's a whole new world now, I think, relative to, I was thinking of some of the meetings I attended in 1982 in Geneva. No one had any numbers about anything. No one knew which countries had a blindness committee. No one knew. There was so much not known. And now we have so much information and an opportunity, and I know Anthea is interested in this with the Vision Atlas. We're very interested in how to really capture and harvest that information.
Thank you. Mr. Thulsiraj, sir, especially you're looking at a lot of data at Aravind.
Yeah. I think if you look at sector level, I think to improve the whole research ecosystem, I think I have four thoughts. One is for a long time, and maybe even now, research was a bad word amongst the international INGOs. Many of them would actually not fund research as a policy. I'm personally aware of that, but it's changing. Like I know Alliance introduced with some, I think with some persuasion, I presume it was Nagra or someone, that they do have an annual research grant giving out. So I think that's an exception. And few of the other INGOs are kind of moving the direction, but I think it would be good if we can advocate to they're all our friends. So I think if we can talk to them to support research in a significant way. There is definitely movement of recognizing why that's important. So that would help a lot. In fact, all INGOs support service delivery. If they can actually mandate a research component in the service delivery, it would go a long way even to improve the service delivery. And the insights will become phenomenal. And I think that's one way we can kind of make this as a integral part of, that's one thought I had. And similarly, this change is happening in India, in the academic world, in the university. Research really didn't have a strong place. But I'm talking about 4 or 5 years back. I think now within India, big changes have happened in terms of, at least in the medical field, that research have to come. The faculty had to publish certain number of papers to get promoted or to get to the next level. So that change has happened. And if this can become more of a theme across the world, in the LMICs, that I think would also push research happening in healthcare in general, and of course, eye sector also would benefit by it. At an operational level, I'm kind of really simplifying good research. Good research, to me, has got 2 components. One is good data, because ultimately it's all about data. How much money we put in, it's the data that we analyze. So how do you get good data? And the second is that how is the study design? I mean, those are the 2 things which finally dictates the quality of this thing. So the rigor, the scientific rigor in doing the studies, that again, it takes a lot of research and experience or a lot of mentorship to come to a certain level. But maybe we can short circuit that learning curve by having some strategic resource centers in different places who can mentor, help these institutions. I think these are some of the ideas that I had, but I also want to conclude with a bit of a caution, because all our thinking to me is on the supply side, how to do good research. But today, the research hunger is not yet there. I think we also need to work on the demand side, because we almost every year we would offer a research methodology workshop. Mailing list will go out to hundreds, thousands of people. We may have 3 registrations. So I think that also has to change. Yeah.
Thank you. Matthew, anything you'd like to add on the sectoral sort of additions that can be done?
Yeah, so a couple of things. So firstly, particularly for those who are staying on for the IPB meeting, just something to watch out for one Wednesday lunchtime is there's a workshop over the lunch hour on the WHO research agenda that's currently being developed. So this is if you like, a sectoral-wide process focusing initially on cataract, refractive error, glaucoma, DR, and child eye health. So 5 focus areas. And it's an opportunity to, as a community, to really do a deep dive think about what are the key questions, what are our priority questions. And I think really encourage people to participate in that. If you are able to attend that workshop, please do, but then there'll be an opportunity to then contribute ideas and participate in that. And I think that, under WHO's leadership, I think will be hopefully really helpful for us as a sector in terms of identifying what are those priority areas that we really need to double down into. What are the big unknowns that a lot of people feel we would really value from doing it. So I think having a shared agenda will be really helpful. So that kind of focuses what we do. I think the other thing is skills development. Something that ICH over the years has been kind of quite involved with, and I know Aravind has as well, and LV Prasad and Prasho now. The sort of things we do work at different levels. There's the Community Eye Health Journal, which many of you may have come across. That's a broad educational journal, occasionally bits of research training in it, but not so much research training. And then there's a whole series of online courses which are freely accessible, and some of you may have looked at those. And within that, there are a couple that are really focused on core research methodologies as applied to eye health research. A number of you have done masters with us, and there are 1 or 2 other places that offer masters or MPHs that have an eye health component in them. And I think that's a really important step if someone is thinking, I'm thinking about building a career in eye health research. I think really spending quality time, really building your skills and understanding, getting those core skills, epidemiology, statistics under your belt. And then if it's for you to then think about, like you are now, Shalinda, for example, then moving on to a PhD and building a whole series of projects around that then become a springboard. And then in addition to that, building up that team around you. So it's very much a journey. And I think that, there's some people will only want to go so far, but still participate. And that's great. But I think there's, like a step ladder of skills to build.
Thank you. Just before opening to the House, I just have one question. Dr. Murthy is sitting there. I'm sorry. Yeah. Because I would like your comment on the sectoral thing. And also Prasho is now doing a lot of capacity building. So.
Right. I think I was just listening very carefully to what Tulsi was saying. And if I go back to one of the first IOL studies, the mild study, the Madurai IOL study, that was a time when IOLs became a practice in the US without evidence. And here, it was the exact opposite. Lahan and Madurai, I think both of you, or Lumbini and Madurai, the two centers where you had the IOL study, which created the evidence. And at that time, the patient appetite for IOLs was very low. Today, the appetite is at a different level. And therefore, you looked at coming to the other end of the spectrum where the patient can actually create the demand, Tulsi. That's what I was just thinking. Every patient, literate patients, urban patients who come to you are coming to you actually for a second opinion because they've all gone through Google before they've come to you. The first opinion is from Google and they're coming to you for the second opinion. So here is an opportunity for those who are interested in research, nudging the patients, ask the doctor, what is the evidence that this works? If 10 or 15 of the patients start asking that question, it actually creates the demand. So you need to look at a reverse demand creation so that the ecosystem then gets built. Maybe that's initially a bit of a fear component, but that fear component fuels the additional interest. And we've seen that happen with ROP in India, where the courts force the decision on ROP screening being mandatory by penalizing a hospital, that to a government hospital, for not screening. So I think it is important to be prepared, which is what we all do as providers, whether it's Prasho or whether it is Seva or whether it is LAICO. We all look at, or at ICH, we all look at preparing. And that preparation time, initially we may be looking at small numbers who are interested. To actually get that into a tsunami sort of a thing, you need the patient buy-in, the patient push, whether we do it through patient advocacy groups or in some other form of patient engagement. I think it is critical that for the future of research, you need to bring in the patient perspective, which will get more and more hospitals on board. That's what I would say.
Selfish and just ask one more question. If I'm not wrong, there are not too many people from the government here. So I'll take the closest is Dr. Praveen Vashisht. So I'll ask him because he's worked with a lot of epidemiological studies and multiple studies representing the government and the national data. What do you think is the role of the government institutions like AIMS to help the sector?
In fact, seriously, I was thinking to ask same question from Tulsi sir. Sir, what are your expectations from the government sector? And you know what I was thinking? That he'll say that there should not be any government. Something like some answer will come out. No bureaucracy. So probably, yeah, it is such a important thing. In fact, Dr. GVS Murthy has wonderful experience, and now I'm also involved in so many projects. And what I always feel that so many people said Praveen is getting all the project from government. Some kind of this kind of remarks are being shared. But I feel that government should give equal opportunity to NGO sector and private sector. They should not just keep that this is a government hospital, then they have to fund only to this hospital. And I'm very happy that this time I had meeting with Thulsiraj with the government. And in fact, they have taken this decision that yes, we will invite the hospitals and the people who are good in research, Aravind Eye Care, LV Prasad, other RP centers, all are being invited. This is one good decision has been taken at the top level. What I feel is that the bureaucrats, maybe they must be given some kind of some initial information training related to research, because what we feel is they are decision makers and they are taking decisions. Sometime we feel very odd decision has been taken. So I don't know how to actually provide them some information or capacity building related to research of these things. This is a very difficult thing, but this is actually what we feel is a need, that bureaucracy is taking lead and the technocrats are being they are down actually. I personally feel that technical expert, the researcher, they should be given more priority in this thing.
Thank you. So I think we should have a research capacity building for the technocrats at Trash.
Murthy want to-
So yeah, now I'm opening it to the house. Yeah, sorry.
Can I just come in with one comment?
Yeah.
The question that you ask is very critical. And for me, the answer is directly government should not be doing the research because of conflict of interest. You have an agenda, you set the agenda, you have a program. So they should facilitate research. And what would be the best way forward would be something like NICE, the National Institute of Clinical Excellence, which is tasked, which is an autonomous body supported by the government, but is tasked with preparation of guidelines, what are the best practices, creating that evidence base. I think something on those lines is perhaps required in most countries, that you have an autonomous body which could have a governmental umbrella but is not directly part of the government.
Thank you. Any other questions?
No, but I just, Shailendra,
Yeah.
I just wanted to, I don't know if Matthew would have some insight. I'm just thinking of China as a country, which I think almost had no publications maybe 15 years back or 20 years back. Today, they are the world's leading. So how did this happen within the last 10, 15 years that they leapfrog to become the highest public? Do you have any thoughts on it? I just have admiration, but no answers.
Yeah, is Amanda here? Maybe she's in the other session. Jackie led a project as part of the Lancet Commission doing a bibliometric analysis from the year 2020 through, sorry, the year 2000 through to 2020 of all the sort of global literature on eye health and ophthalmology, excluding reviews and case studies. There's about 150,000 publications during that period. During that period, there was basically a doubling of the output per annum. And what was striking was the exponential rise. I think China is now, well, at that stage, it was number 2 behind the US, but you might well be right. It may have exceeded the US output. I mean, clearly, China's been, that is just a reflection of the amazing journey China has been on over those 2 decades in terms of its general development, particularly in its academic, institutions, and also huge investment. They are really investing in a way that perhaps few countries are, because they've recognized that its relevance to the development. And I sort of look at my own country and I think, oh, I wish they would spend a bit more on R&D. And I imagine our American colleagues are thinking, I wish they wouldn't have pulled the plug on our R&D. And I think there's strategic thought that's gone into that, and it's really bearing fruit.
Something, yeah.
Yeah, I think Reena had a question, then Sanil. Yeah.
Many people will agree or not, because some of you are saying that we should buy, like there should be no bureaucracy or government, but I believe without taking like private and public partnership, I don't think we will be able to escalate. The reason why I'm saying is that the tertiary level eye care of Nepal is top notch. But if you see the primary eye care and from the community preventive package, which we did recently, it's not been able to escalate. It's not the first time that we have been doing it. The view has been advocating for community eye health, promoting community eye health, and the Bhaktapur Cornell study is also promoting, but it's not somehow been able to escalate. And without bringing the government, I know government has a lot other serious issues like HIV, maternal health to take care of, but without taking government into consideration, I don't think we will be able to really scale up the community level. And I don't think not many people will not agree, or I don't know, but we will not be able, there's no any harm in anybody's business, like in terms of like they have their equal roles to play. I think, for example, trachoma without government and NGOs involvement, private involvement, it would not have been eliminated.
Yeah.
So I think it should have come hand in hand, and we should advocate for it.
Yeah, thank you. You
No,
wanted to
I just
respond?
wanted to concur that I think government has got a huge role, and I would say even responsible to kind of promote research. Certainly, there is no argument there. But then it all depends upon how it actually plays out. You know, like quite often, at least in Indian context, whether it is in the academics or in research, the government has a role of, but then quite often they see the role as regulating rather than facilitating. So they kind of are more into controlling. Now, do you have this? Do you have that? So it's not very encouraging. So that's the bureaucracy part, which I think if that can go away, then it would, if that can change into facilitating, help. Yeah.
We have a question from Samir. And I think by the time the mic is being passed, just to add to that point, and we are stuck right now there's a committee which has to pass some trial. There's no timeline for the committee to respond. Exactly. So then you're stuck with the grant with a limited period to finish the study, but you can't start before because you have all the ethics, but you don't have the government permission. So I think that it has to be more answerable and just not regulatory. Yeah, thank you.
This is not a question, it's a comment related to the one of the points that Mr. Thulsiraj made about the research appetite among individuals and institutions. And I got this thought by listening to some of the presentations. I had, there has been instances of a couple of the presenters apologizing in the beginning, telling that I'm not a researcher, I'm working in operations. No, so I think nobody should have that kind of feeling. So in my opinion, the best person to do operations research is somebody involved in operations, not an academic researcher, and it should be the other way. And a connected point is that I mean, in many places, or in terms of the perception of people when you talk about research, is just to publish. But I think that way this is encouraging that Seva Canada is taking this initiative of evidence-informed practice. The title itself is very important rather than research capacity building. Because first what should be done is to encourage people to look at their own data as a starting point, which can improve their own decision making, their own operational activities, and out of that some trends and lessons can come out, and that can be taken up as a publication. Or so unless that is there, the only time when people think of doing something like this is when there is a call for abstract from a conference.
Yeah, Bala had a question.
Just a point to add to what Sanil sir has said. So can we also look at, of course, we are mandating the curriculum for medical and other health professionals. Can we also look at how we place research? Because what happens with postgraduates, because they are doing the bulk of the research, or clinical researchers or fellows, is that they have to submit their protocol in the first 3 months they join. So if I am just passing out from internship, I am preparing for competitive exams. in the first 3 months, I have not even understood my own department first. How would I understand what kind of research I would like to do? Because oftentimes, if you ask any clinician, his worst research work would be his post-graduation thesis, because he submitted the protocol before understanding what he wanted to do.
Absolutely.
Maybe can we look at just replacing the guidelines in the curriculum, not remove it, but maybe probably give them 6 months or 1 year, let them work in the department and then form their research protocol, because anyhow they're going to do it in the second or third year.
I think that's a fallacy in the system, and I think I'm guiding some of the DNB students, and I only ask them to come to me, at least understand the research question from your mentor before you come for discussion, but because they don't know the subject.
Can I please?
Yeah, please.
I think since 2019, from NMC, National Medical Commission, and along with ICMR has developed a course called BCBR, Basic Course in Biomedical Research for the first year undergraduates as well as faculty. And that says that everybody has to undergo that, and then they have to develop the research protocol or whatever. The practice is, I was part of that BCBR. The practice, what we have noticed is, no, they do not go for this. They just pass, they just do it. And what is their main idea is, even the guide do not understand, they also ask someone to do it on behalf of them. The understanding is, they are not interested in most of the cases, because it is only required for their promotion or something else, and for the PGs it is only required for them to get away for their completion of the masters. So hard to answer really, but only thing we can do is, from institutional level, one suggestion is incentivizing the work and appropriately acknowledging the word. And not only that, if we do not, being clinician, if we do not want to do research, we have to understand that we can be the consumer of research as well. Because if we want to do a good practice, forget about all research activities, if we want to do research only, clinical practice only, and good clinical practice, then also we have to consume research, because that understanding is important to do that. So as a whole, it is required. That level of understanding we should convey to the world. Thank you.
Okay. So maybe we'll take one more question. Close now. Yeah.
You said that the government should become facilitators instead of only doing regulations. And I have also faced a lot of problems with this. And instead of, encouraging and doing something, they put barriers in your path. So is there anything that we could do, at least in the long run, that they become facilitators instead of regulators? Is there some points that we could all put our heads together and do something about this? Because this is really a major barrier to research.
I fully agree. I think, like you said, the stars have to align, the right people have to be there, then I think something can be done. But I think things can happen. I'll give a couple of examples. There is a medical terminology standards called as SNOMED, like ICD-10. It is something that you have to license if you want to use that. That helps because that helps you to standardize in the EMR. If you integrate that, all your terminologies become standardized, helps in research and things like that. So typically institutions would have to license it separately. But Government of India has taken a license for the whole country. So anybody who's using a EMR, if they want to integrate that, it's kind of free. You're saving literally thousands of dollars per year in licensing. Second example, Rajiv Gandhi Medical University, from the state where you come from. That's a medical university, right? So they have taken a subscription for all the medical journals, which makes it free for all the medical colleges affiliated to it and to all its students. So imagine the power of that. No, so every student has got access to all medical journals. No, so these are policy decisions which is done at the right time by one. You have the right bureaucrat. No, the money is not such a big challenge when it comes to the government to do this. So I think, like you said, if we apply our mind and work in it in a concerted way, I think we can make this happen. And if it happens once, it will probably continue. No, it may not. Like say we had this DBCS thing happen when we had those stars that you showed yesterday. No, so that still continues. Yeah.
Thank you. I think we'll end with the positive note, and thanks to all the panelists for being there. Thank you very much.